Hey there, I'm Piper. I'm a physician assistant on your team, and we're going to talk today about most common problems after surgery that we see and how to avoid them, as well as walk through some of the steps to help you to be successful long-term in this weight loss journey. At this point in the process, you should have your labs completed, your T&E or EGD evaluation done, cardiac clearance, and your psych evaluation completed if that's part of the process. As far as expectations with weight loss after surgery, most commonly what I see at 4 to 6 weeks post-op is 15 to 30 pounds of weight loss. Part of what determines where you will be on that scale are things like your gender, your metabolism, how active you are, how well you follow instructions from the dietitian, including what you eat and when you eat and how much of it. And that's a good goal to shoot for though, 15 to 30 pounds at 4 to 6 weeks post-op. Two of the most common problems that we see after surgery that thankfully are both avoidable are constipation and dehydration. The best thing that you can do to avoid the constipation is first try to have a bowel movement the day before surgery. And if you find that you've not had a bowel movement within 2 days after surgery, you can add a laxative such as Miralax to what you're taking to help move your bowels along. A couple of the reasons we see that is not enough fluids taken, and the anesthesia after surgery can contribute to the bowel slowing down. That can make people feel miserable. So if you do get constipated, be sure to add in that laxative to what you're doing. One other key that you can make sure you're doing is walking. The more active you are, the more your bowels are going to move and the more comfortable you will feel. Now, related to dehydration. Dehydration makes people feel awful, and we want to avoid that in you. So every 10 to 15 minutes, take a sip of fluid. You're going to learn how big that sip needs to be based on how you feel when you drink. So test it and see. The way that you know you've had too big of a sip or you're drinking too fast or too much is if it feels uncomfortable as you're doing it. So really work to drink, drink, drink. Otherwise you cannot overdrink. More commonly, in fact, people underdrink. So really focus on your drinking. Set an alarm on your phone, if that's helpful, to go off every 10 minutes as a reminder. Stay up on your fluids. That'll make you feel better. Drink, drink, drink. That'll be key to your success after surgery. One complication that we want to avoid after surgery is getting a clot, either a DVT or a pulmonary embolism, and people are at an increased risk for either of those complications after surgery, including bariatric surgery. So a couple of things that you can do to help reduce your risk. First, walk. Walk 5 to 10 minutes of every hour you're awake after surgery. Now, when you're resting, sleep, allow yourself that. That's an important part of the healing process. However, as you go through your day, you need to be active and more active than you might be otherwise, even if it's uncomfortable. If you have gas pain, get up and walk. Even if you have some belly discomfort and you think, I don't want to walk because it hurts, get up and do it anyway. You'll be glad you did because your healing will be quicker and you'll get to your goal weight loss sooner as well. You'll feel better after all if you're active. So when do I call the clinic with problems if I have them post-op? Here are some specific things to look for and watch for that might be concerning after surgery. Dizziness, lightheadedness, nausea, vomiting, pain that is not controlled with pain medication, or pain that's worrisome or bothersome to you. That may be in your shoulders, in your stomach, any kind of significant pain. Call us and update us if that happens. The other concerning symptom is fever over 101. When I see people post-operatively, the most common complaint that they have, if they have any complaint, is gas pain, potentially that could be in the upper chest or between the shoulders on the back. So if you have that, the way to treat it is use your Gas-X that you have, get up and walk, get up and walk. I can tell you that's going to be most helpful. But the other thing that you can do is use a heating pad to the area if you have some discomfort there. What can I expect? Some people ask as far as incisions go after surgery. Most commonly, people get 5 to 7 incisions for the laparoscopic surgery that are 5 to 12 millimeters in size. The doctor will put suture at your skin level, and that suture absorbs on its own over time, and then there will be glue on top of that suture. That glue you can leave alone. It'll stay for about 2 weeks afterwards and flake off on its own. Concerning wound care after surgery, it's okay to wash and shower 24 hours after surgery. Don't scrub your incisions, otherwise keep them clean and dry. Another thing to watch for post-op is wounds healing well. So if you have any concerns with redness around your wound, swelling around your wound, increased pain or tenderness, any kind of discharge that looks abnormal, then call the provider for further instructions. Your limitations after surgery are no lifting over 10 pounds for 3 weeks. We don't want a hernia at the level of your incisions at the skin, and that'll help prevent that from happening. Otherwise, be as active as you can be. In fact, the more active you are, the better you'll feel and the better results you'll have long term. The people that I see do the best post-operatively in getting to their goal weight and maintaining that goal weight are consistent with their exercise. So make that a priority. You'll see that that is worth doing as an investment in your long-term success. And that's what we're here for. We're here for your long-term success. Your success post-operatively is greatly dependent on how you follow instructions and take care of yourself. So make yourself a priority. You're worth it, and you'll be glad you did it.